we are back with WHHI-TV, and I have Ginger Allen with me, who is the Director of Development at VIMS here on Hilton Head Island, and delightful to meet you.
Thank you for having me.
I am a big supporter of the VIMS program. I mean, it does make a difference for our community.
It sure does.
So let's have a quick background check about what it is to do for our communities, for our viewers.
Yes, so Volunteers in Medicine started in 1993. We were founded by the late Dr. Jack McConnell, who moved here to retire. And as he retired to play golf, he discovered that he actually had never been so bored in his entire life. And as a physician, he also saw that there was such a need here for healthcare. There were so many who lived on this island. Actually, back then, about a third of the island population had no access to healthcare. So he saw this need, and he also saw all of these retirees here on the island who still wanted to give back and do something meaningful with their lives. And he and other VIM pioneers, such as Dr. Joe Black, came together and started Volunteers in Medicine. And so that very first year, they saw about 1,000 patient visits. That was mainly vaccinations. And now, 28 years later, we see anywhere between 28 and 30,000 patient visits each year. We have 23 medical specialties and 5 disease management clinics, and truly are a comprehensive medical home for our patients. And I'll tell you, in fact, that the Hilton Head Island model was so successful that there are now 92 other VIM clinics around the country that are based on the Hilton Head Island model. So essentially, if you think of it, because of Dr. Jack's vision, hundreds of thousands of people across the country have had access to healthcare who otherwise would have gone without. And tens of thousands of people have been able to experience the joy of serving others as volunteers. I failed to mention that at Volunteers in Medicine on Hilton Head, we have about 600 volunteers, so it's a small army.
It really is. Oh my God!
You know, as you know.
Yes, I do know. And I've had a chance to interview the doctors on occasion for other and other reasons, and it's a wonderful story. You know, they retired. They have a specialty. It's amazing the specialties that are here. I mean, there's surgeons and oncologists, and it's across the board.
Absolutely.
And yet they're coming in to help the community. I love that idea, and VIMS is very important. Like you said, and Hilton Head was a great incubator, and it's such a compliment to be able to take this footprint and share it around the country.
It sure
as well.
is. And the physicians, the best thing about VIM is they get to collaborate with each other, and you don't have that in other healthcare settings. So we could have a podiatrist who is working with an endocrinologist, and they're able to talk to each other to come up with diagnoses for our patients.
Exactly. That was an interesting conversation I had. So I love the idea, but let's talk about what's our hot topic today. It's the COVID vaccine.
Absolutely.
And how are we doing with that? Is it available at the clinics?
So, well, first of all, I'll say the VIM patients in our patient demographic were among the very hardest hit by this pandemic in terms of lost wages and unemployment. We serve a lot of the frontline workers. So these are the grocery store workers, the landscapers, the golf course workers, the food and beverage industry employees that don't have the luxury of social distancing or working from home, and many of them were exposed to the virus. So during the beginning of the pandemic, we actually had a 9-week shutdown at the clinic, which was unfortunate, but we were able to offer telemedicine for our patients and also prescription refills, which is so critical to our chronic disease patients. But now what our focus is on is vaccinations. We are actively working to pre-register our patients for vaccinations so that when they're eligible, when they're in the phase of vaccination, then they'll be able to receive it. We're also working so hard to educate our patients on the safety and efficacy of the vaccines, which is so important because there's actually a lot of mistrust in some of our patient population for the vaccines and the government. So we're actively working, and they trust VIM. So we're working with them to ensure that they are fully educated about how important this vaccine is. And in about 2 weeks, we are going to be receiving our first batch of the vaccine, thankfully. So we, as soon as we get it, are going to be actively working to vaccinate our patients and ensure that they are protected from this horrible virus.
Oh, absolutely. And I love such a proactive approach as well. I mean, you have a small army, it's 600 people, it's moving them around and being proactive in our community, and with, reaching out to a whole population that needs health. And
That's right.
Knowing that the vaccine now can be obtained, that's terrific. And, and I love the idea of, again, we're just here to help. And I know the docs sort of like to get together too, because they still want to talk shop sometimes as well when they don't have
That's
a
right.
chance to. So it gives them the opportunity. So it makes everybody feel good.
That's right. I mean, VIM is truly a vital community resource to keep all of our community healthy.
So let me ask you, it is a vital community resource. So how do we fund this? Let's talk about that, because that's very important.
Thank you. Yes, that is very important. So VIM operates on about a $2.5 million budget annually. But with that, we are able to offer about $13 million worth of health care. And we saved the local hospital about $7+ million in uncompensated emergency room visits, because where else is somebody going to go to receive their health care if they don't have a VIM? So we are able to do that, but we accept no government funding. We don't seek or accept any government funding. We strictly rely on the generosity of individuals, foundations, and local businesses who are part of our Companies Who Care program. Some of them give to us outright in terms of sponsorships, and others might host events for us. For example, there is a Sip and Shop event at the J. McLaughlin on Main Street, March 19th and 20th, and they're giving 15% of the proceeds back to Volunteers in Medicine. So this is how we are able to provide this care for all of our neighbors who need us most. We are very fortunate that so many see what a vital community resource we are, and that we need to keep going. We always welcome people, especially those new to the island who may not be very familiar with the clinic, to come for a tour, because until you witness VIM in action, you don't really know what all goes on there. And everyone walks away saying, wow, I had no idea about the scope of work that goes on there in the clinic.
It's a wonderful product. It's wonderful for our community, and we're so fortunate too, because we have a community that really does give back in both ways.
They sure do.
Well, Ginger, I want to thank you very much for coming today.
Yeah, it was nice to meet you.
Very nice to meet you as well. And please give to the VIMS Project, the program. It's very important. And we'll be right back with more 843 TV.